So what is Ozempic face and how can you avoid it? If you've done any research on the GLP-1 agonist Ozempic, you've come across a side effect or a crazy picture of someone and they have the title or they have something underneath that says Ozempic face. What is going on there? My name is Dr. G, and I'm an internal medicine doctor in Hollywood, Florida, and I specialize in lifestyle modifications, weight loss management, and I have a pretty good experience treating patients with the GLP-1 agonists such as Ozempic and Mounjaro, better known as semaglutide and tirzepatide respectively. So what is going on with Ozempic face? Let's talk a little bit about anatomy really quickly. One of the things that you may not think about is fat underneath the skin is actually what makes us look like what we look like. Some people would say it actually gives people the attractiveness or their distinct look is because of the fat that's under their skin, right? Many women have curves, and men have curves too, and that's because of the fat, the way the fat is seen underneath the skin. In the face, the fullness of the face is mostly given not only by muscle, but mostly by fat. Chubby babies, the chunky babies, is because of the fat that's laying underneath the skin there. That's what made babies look the way they look. And they have that fat in their bodies as they're growing in the womb for a reason. And we have it for a reason when when we're adults, and that's to give us our features. Especially when you lose weight really, really quickly, you tend to lose the fat in the subcutaneous space, which is subcutaneous means right underneath the skin, and you get this hollowed out appearance, maybe in the temple areas or right here in the cheeks. And this is something that happens when you lose weight. It also happens naturally as you get older. For many of our older population, you'll have this same gaunt look where they look hollowed out. And that's where fillers came in, cosmetic fillers, where doctors and clinicians use a substance. It actually basically just pulls in water, it soaks in water, and it gives this fullness appearance to places in the face or other parts of the body which needs to be filled in. That's what a filler is, basically. Replacing what probably maybe in some people has never been there, but in other people they've lost over the years and they want that look back. That's what subcutaneous fat, that's what fillers are trying to do for subcutaneous fat. But in this case, in Ozempic, we're inducing weight loss by decreasing the appetite, and if you're doing it the right way, increasing your activity. And if you do it very quickly, you can induce the quote Ozempic face. And that means hollowing out of the cheeks areas and then the temples. That's basically where you see most of this fat that is lost. And then the skin has no structure. It has nothing underneath it to hold it up. And then you'll get the drooping of the skin after that. So is this inevitable? Is this going to happen to every single one of our patients that start to use Ozempic for semaglutide for weight loss or for diabetes for that matter? Is this something that is unavoidable? Absolutely not. If you follow my page, one of our approaches to using the GLP-1 agonist is to start low and to go slow, promoting a weight loss that is healthy for each and every single patient on a weekly basis, monthly basis, and monitoring how quickly we're losing the weight. Some patients can stand to lose 2 to 3, 4 pounds a week. Some patients can't. The weight goal is not that large. You may want to go slower. You may want to average out 1 to 2 and not go to the 4 to 5 range with losing weight because you may be losing it too quickly. You go slow with the medications is the first thing that you should do in order to avoid that look, that Ozempic face look. Another thing you might want to look into is if you are on one of the GLP-1 agonist medications and you notice that you are losing quickly and on a lower dose, you are very sensitive to that particular medication and may want to try another one, right? Try another medication and see if that one on the lowest dose, you will lose an appropriate amount of weight on a weekly or monthly basis. Monitor how much you're losing and to make sure that you are not going to get that result that you do not want, which is the Ozempic face or that gaunt, hollowed out looking face that honestly just don't look as healthy, even though you may be. I mean, it doesn't mean you're unhealthy just because you have that gaunt look. That's not something that's aesthetically pleasing to many people. If you follow any of my other videos on this channel, the next tip is going to seem like deja vu, I guess. One of the things that you can do to slow down or to avoid the Ozempic face look is to make sure that you have calculated out and you are maintaining the proper amount of macronutrients. That means making sure that you've calculated out your proteins, your good fats, and your good carbohydrate intakes, and make sure you follow that and try to stay as close to that model or those calculations as possible. That will also help to keep the proper amounts of fat and muscle that you will need in order to maintain the structures, the way, and keep everything where it needs to be. So maintaining the nutrition with the proper amount of macronutrients, proteins, fats, and carbohydrates is the next tip to avoid the Ozempic face. I kind of mentioned this last tip at the beginning, but I'll say it again. Obviously, if you do end up having some hollowed out, gaunt appearance, you may want to look into maybe some fillers in order to fill in the spaces. I know it's not something that most people will do, but it is an option for some people. If you have spaces in your face where you may have lost too much fat, or maybe you just didn't have that much fat to begin with in those places of your face, ended up losing weight even appropriately, and you ended up losing weight after being on a medication like Ozempic, the goal that you want to be at, your weight goal, or whatever the goal is for you. It might be, something that you just wanted to do in order to get your nutrition together, and maybe it's not a weight goal, it's a nutrition thing. You wanted to change some of these bad habits, kill off some of the noise, whatever it is. If you've lost some of that subcutaneous fat in your face and you're not very happy with the way it looks, a little bit of filler in the right places by the right person, the right doctor, goes a long way. It definitely could reverse some of the hollowed out looking face that you just don't like. So yeah, fillers is another option for you if you are suffering from the Ozempic face. Last but not least, and definitely the most important part, I'm a little biased by this, by being a lifestyle modification coach, but lifestyle modifications are paramount to this. Why? If we can come off of the medications quicker because we have now gotten our nutrition, our mental state together, we've gotten our behaviors together, and we have our activities together, our exercise, we've gotten that all together with all the information in our team, and we don't really need to be on a medication like a GLP-1 agonist or any other weight loss medication. We avoid possibly having the Ozempic face because we can come off of those medications and then now use the skills that we have now honed in and learned over the last 2 months, if we can get there quick enough, and use those skills in order to maintain and promote healthy weight loss, slow, graduated weight loss. The weight loss journey is a weight loss journey. There's no race, there's no time limit to get there. You can set out your goal for, year or year and a half and slowly chip away at that number, and you will greatly reduce your possibility of developing the Ozempic face. So lifestyle modifications, last but not least, and definitely the most important. That's everything about the Ozempic face that you need to know, really. I mean, losing subcutaneous fat, losing weight too quickly, not monitoring your macronutrients the way you should. Using fillers is an option. And of course, lifestyle modifications, getting on top of why you eat, when you eat, what emotional state you are when you are eating, what motivates you to get off the couch and do some activity, do some exercise. Those things will help you avoid the Ozempic face. It's not a good look for a lot of folks, I guess. Anyway, that's all for today. If you'd like to get some more information, or if you'd like to jump on one of the sessions for our lifestyle modification program here at FCMW, you get one-to-one coaching with me where we walk through things like this and your specific issues. Go ahead and comment coaching down below, and we will get you on the list, and you can get all the information on how to jump on a call with me. All right, see you soon.